event. But a national epidemic such as the one we're facing now is just not something this country was honestly prepared for. On top of that, you had this has been going on in China since the end of last year. There was manufacturing that was shut down there for an extended period of time. There was a backlog of goods in that country that needed to make its way out from an export standpoint. And so that accompanied by the fact that all of the large airlines are shut down, and there's not flights that are going between China and the U.S. and other parts of Asia and the U.S., has significantly hampered the ability to actually move goods. One of the departments I run at Team Health is travel, and travel schedules. If Delta Airlines, for example, is only flying 20% of their normal schedule at present, with a 13% occupancy on that 20% of their schedule. So doing the math backwards, that comes out to about 2.9% of their revenue they're currently sitting at on a day in and day out basis. So there's a lot of economic factors that go into this and a lot of issues. So from a supply chain standpoint, the U.S. medical PPE supply chain was not prepared for this event. We did not move into a position to have materials and supplies in place, and I think that's come to light within the last 2 weeks. The Chinese suppliers that typically supply a lot of these goods experienced downtime and were actually using materials for their own needs as they moved through the COVID crisis. And so that lowered supply that was actually coming into the U.S. on top of the fact we did not have a large enough warehouse of materials. Typically in the medical space, McKesson and Henry Schein and other domestic companies are the major suppliers to the hospital systems. They're very rigid in what they do with lots of regulations by the U.S. Those companies, along with the facility domestic stockpiles, became strained within about 2 weeks of the first COVID cases hitting in the U.S. And most of that was in Washington State, followed by the New York events. The government and the FEMA supplies were, as I said, suitable for regional events, but not this national epidemic. So Team Health, we recognized this and started hearing issues about it back the week of March 15th. And we launched a sourcing initiative on March 18th in response to initial reports of facility PPE shortages in Washington State and what we were hearing in the New York area. Our first initiatives was to really understand what those PPE shortages were and also determine what the PPE usage was going to be, which became difficult as this was not something that really our frontline staff had dealt with this type of virus before to really understand what their usage and their burn factor was going to be. But we really needed that in order to have forecasting guidance that we could have. So we placed initial orders for PPE on March 18th, and then on March 19th, we started an effort to try and understand what a forecasting guidance would look like. We took on partners when we did this. We're owned by a private equity firm out of New York called Blackstone. And so Blackstone has lots of variety within their investments. So we picked up a company called Apria Healthcare out of California that's in the CPAP and oxygen generator business. We picked up a company in Gallatin, Tennessee by the name of ServPro. ServPro was working to do disinfection and cleaning of some of the senior living centers in Washington State and knew that there would be demand for that on a go-forward basis. We picked up G6, which is a hospitality company that owns Motel 6. So along the way, we picked up other partners that had needs similar to ours. And what we did was to sort of bet across multiple vendors and multiple manufacturers in China in order to try and hedge our bets that we would receive materials and that the materials we received would be quality materials. Also during this time, initial guidance on materials was an N95 mask was required for response to COVID situations. The CDC actually opened up the requirements on that, allowing masks that met other international standards to be introduced and made available. And so the KN95 mask, which is the Chinese version of an N95, was added into the CDC approved list in response to the event as they were working through the shortages that occurred. So the first PPE items we ordered were N95 or KN95 masks. In order to help prolong the use of those masks, we began trying to get 3-ply or type 3, level 3 surgical masks that are more your common ear loop masks. Goggles become a necessity because of the way the virus spreads. So we looked at over OTG type safety glasses or goggles, face shields, and then ultimately there was a need for gowns as the event went to move on. So those are the main categories of items that are in need from a PPE standpoint. The goggles were actually able to be, we found those through a couple manufacturers in Ohio, a warehouse in New Jersey, and a manufacturer in South Carolina. We were able actually to source those fairly quickly. But the majority of the other materials, the 2 different types of masks and the gowns, were going to have to come from other places. We just were not set up to manufacture that in this country. So that's kind of the background. I know that's a little bit longer answer maybe than you expected, Danny, but I thought just kind of a historical view on this and where we're at might be important for this group.
Yeah, so that is perfect and kind of leads me into my next question, which is, what are your views for the next couple of weeks? Your view of team health's needs, as well as kind of a view of the country's needs, and then further out, 6 months from now, when we have a lot of manufacturers on the country on the call that are trying to figure out, can they help in time, and can this be something that's sustainable?
So the face shields are still a continued need, which those are relatively simple in manufacture. I know that I live in Blount County, Tennessee, so Denso Manufacturing here, I know they shifted some of their production out of one of their shops over and made some face shields out of their shop that were available. There was a small manufacturer that actually manufactures furniture over in North Carolina that had reached out to me and said, hey, what could we do? And so they actually are working to make manufacture some face shields with some of their production line, and they're also looking at making gowns, like surgical gowns that could actually be laundered and reused. I've talked to some of the folks in the hospitality industry, and they're interested in those type of linen gowns for their housekeeping staff, so that their folks can essentially come into work, put on a gown, go about their day, and then those materials can be laundered at the end of the day. So any of that PPE that we could source locally, the issue with these orders, we placed orders and funded on March 18th and 19th for masks, and we still have not received all of those orders. The real issue is that Chinese export customs is backed up anywhere from 2 to 3 days to get through that process. It takes another 3 to 4 days to get an airlift underneath an order. They're limiting quantities of orders based on what address they're going to in the U.S. So they're rationing what space of an airplane you can get as an importer, and then the import inspections are taking anywhere from 2 to 3 days. And then another 24 hours once you come through the import exercise to actually get it out to your facility. And all that comes, number one, at a lot of time that's wasted to try and get materials to the front line. But number two, it's at a high expense. So, when we've looked at cost for materials, we have to weigh in what just the base cost is for the material, but then also all of the shipping, handling, and freight to actually move those materials, along with the delay in timing. So anything we can do to manufacture these products at a local level would be great. The virus, obviously, New York City is the big headline. Detroit is probably right behind it at this point. Washington State feels like they're on the other side of the curve. The South Florida area is beginning to heat up as you watch the maps. And this is not just news reports or other reports that you have. Team Health has a call 3 times a week in which we get on the phone with the clinical leadership of the organization, and they give us reports of what they're seeing for volumes around the country. So this is more of a from the clinical perspective than from a health department or a national reporting perspective. But that's what we're seeing. The real fear is when it begins to move and migrate, and we see the uptick that occurs in the smaller markets, the mid to small markets. Those hospital systems are not as large. They probably don't carry as large of a PPE inventory. is what you're seeing, in some of these larger areas, and they won't get the support that some of the larger areas are happening. People are Fox News is not going to break over to listen to probably the governor of Arkansas, whereas they're going to carry the governor of New York every time he speaks, likely. So I feel like that's where it's really going, and where this group could probably really jump in and help in your local communities with some of these materials. The cloth face masks are also something that has really taken off. That's more for administrative and non-clinical staff in a lot of these settings that's being used for. But I see hospitals in the South particularly in the Southeast, continue to request those. But it seems to have gathered some legs and become more of a national request for those at this time also.
Thanks so much, Chris. Could you speak just a little bit to the number? Your
Go ahead, Danny. I got it.
okay. Could you speak just a little bit more to what we're hearing in the news? And for example, 2.8 million N95 masks were announced last night. 2.8 million surgical masks. I think there was some partnership, a number with 3M at 160 million masks over a 3 or 4 month period. Is that a drop in the bucket, or is that a substantial number that could kind of change the game? Those numbers that we heard last night from the Presidential Task Force. Are you aware of those numbers?
So we're working, I heard those numbers last night. We're working right now to place an order this afternoon as a collective group of about 5 companies for a mask order of almost 3 million masks. And we're hoping to have those delivered next week. As I mentioned earlier, Danny, it's kind of hard to project this thing out. There's lots of different graphs on it, but really until we can get, immunization for this and understand it better as far as what treatments can be, we believe that this event's going to move forward for another 60 to 90 days, just in terms of what the needs for these materials will be. One of the partners in this order we're working on now for 3 million, actually 2 of the partners in it are in the senior housing area. So they're in the senior residential type housing. So they forecast that they're going to have an extended need. And keep in mind, their facilities are on lockdown at present. Okay. So there's no one in, no one out other than their staff. So their current order and their needs are only for their staff. If there's a point in time that they open that back up, and based on the latest guidance from the government, I think there'll be even more of a need for masks on a go-forward basis. One thing to mention, if you get into the details of this, an N95 mask requires a fit test. So there's an annual fit test process that you have to go through, because it's not a very pliable mask when you think of a typical dust mask that you wear like an ear loop mask. The KN95 version actually is more pliable and does not require sizing and the fit test requirement that the N95 has. I think the surgical masks are also going to be important, and they will have to be produced in a much larger quantity over time, and probably for a longer duration than either the N95s or KN95s.
Great. Well, thank you so much, Chris, for your time. We really appreciate it, and we hope that you are able to find the supplies that you desperately need to supply those emergency clinicians.
Again, I worked, before I went to work for Team Health, I was in the construction business and worked with a lot of manufacturers in the East Tennessee area. And I always loved to see manufacturing stay domestic in the U.S., especially, in my home state of Tennessee. I'm a proud graduate of the University of Tennessee College of Engineering, is my actual background, even though I do procurement and other stuff now. So always really, really great to hear about efforts to keep manufacturing here and come up with new and innovative ways of doing that. So great to hear that this group's out there and trying to do what it can to aid during this epidemic.
Thank you so much, Chris. So Chris was our representative from the private sector as far as answering the question of who's going to buy these products for us, from us as manufacturers. So Now we want to turn our attention to the public sector leadership, and in order to get a better sense for what's going on from the federal level and the state level, we've asked Kelly Boutwell from the Tennessee Chamber to join us. Kelly, are you on the call?
Hey there, I'm here. I don't know if, can y'all hear me?
Yes, thank you so much, Kelly. Thanks for being on the call. Could you just briefly introduce yourself and kind of describe what's the plan of attack with your organization and how you're integrating with other organizations across the state?
Sure, and thanks again for having us, inviting us to participate today in this webinar. So Kelly Boutwell with the Tennessee Chamber of Commerce, to give you an idea of who and what we are. So we serve as the State Chamber of Commerce in Tennessee and the State Manufacturers Association. We're a private, not-for-profit business group, and we've got members all across the state of Tennessee, and originally started as the State Trade Association for manufacturers before also becoming the State Chamber. So that said, we represent business and manufacturers of all shapes and sizes across the state of Tennessee. I think Chris covered a lot of ground, but as a member-based organization, our members, with the bulk of them being manufacturers, reached out to us, started reaching out to say, hey, we want to help. This was also coinciding with the president invoking the Defense Production Act, and so we have been working in coordination with UTCIS. Our CEO, Bradley Jackson, is on the statewide task force for the COVID-19 response in Tennessee. And we've been working with, of course, our national trade groups. We're the state affiliate for the U.S. Chamber, the state affiliate for NAM, and the state affiliate for the American Chemistry Council. Helping our businesses and manufacturers navigate who's essential, how they can navigate that within their own operations and communicating that with their employees. But this newest piece is last Wednesday, we officially launched Tennessee Creators Respond, which is modeled after a similar program from the National Association of Manufacturers. And talking with Paul and the UTCIS team, initially started out with a phone call and surveys to say, hey, what can you make? I know you want to help. What can you make? What could you potentially retool? So you can check out our webpage, www.tnchamber.org. If you want to go directly to the Tennessee Chamber Responds page, it's www.tnchamber.org/response. And essentially, this is meant to do a lot of what Chris said, which is to bridge the gap between the immediate needs in the state of Tennessee on the healthcare and provider side with the unique capabilities and capacities of manufacturers on the ground here in Tennessee. And so there are essentially two paths. I'm a manufacturer, I want to help, or I'm a healthcare provider and I need help. And from there, they fill out basic information. And a lot of what we're trying to do is to make those connections on the ability to collaborate. Because, for example, one manufacturer may have a major piece of the final product, but maybe they need a silicone piece to add to it and they don't have the capabilities. And in that case, we have been able to, are starting to make connections among the manufacturers on the ground here in Tennessee. We've had a tremendous response, and we're working through all of those connections, working with the healthcare providers. Right now, what we're hearing on the ground, Chris covered, is isolation gowns and N95 masks. And then on the flip side of that, if a manufacturer can provide something, are they going to be able to provide it at cost that is even remotely competitive with the pricing that our providers have been purchasing for years. So I think somebody asked a question. I can open up for questions now if y'all want more information. But we appreciate the tremendous partnership we've had with UTCIS in really brainstorming with what we can do within the state to respond to this.
Great. And Misty we've asked the participants to submit questions via
Sure.
the chat feature.
Okay.
And so Misty is going to try to identify a couple of questions for you. And while she does that, I'll just ask kind of the first question. You mentioned some of those supplies, isolation gowns, for example. Could you kind of step us through if TEMA or some other organization were to put out could you kind of step us through the procurement process, what that would look like in order for them to get those supplies that they need, and what the timeline would that be?
I don't have a timeline right now, and I think that you're hitting at the biggest sort of challenge in this whole process. Healthcare providers can tell us all day that they need isolation gowns, but what are the design and material specs? What are the pricing specs? So we need all of that to then in turn share with our manufacturers. That's been one of the biggest immediate challenges in getting the actual information. I've had some healthcare providers say that they are willing to take samples, have manufacturers send them samples overnight so they can certify it and make sure that it meets their standards, and then go from there. But that is where I don't have a great answer for you there. We're working through that right now.
Okay. Misty, do you have a couple of questions for Kelly?
We do have one question, and Chris, you may also be able to help us with this one. I'll just read it out. In the chemical industry, you couldn't work in an area that may require masks at some point, not using continuously. If you had respiratory challenges, should those people wear a preventive mask if that would affect their normal breathing?
So that is correct. So an N95 mask is not meant for continuous wear. So that's why they're masking now at all times with a protective mask, like a ear loop level 3 surgical mask is what they're using. And then they use the N95s when they're actually in the areas where COVID is present. A couple of the facilities in Detroit and New York have switched over to COVID only. And in those cases, they're actually moving over to P100 respirators with the screw-in type filter media is what they're moving over to.
Okay, thank you. Then we had one more about 3D printing. We're in a school with roughly 15 3D printers. We just want to 3D print and help. Do we have to print in a clean or sterile environment to print?
I think it would, in my opinion, it would depend on the materials you're printing. So if you were printing up the headwear piece that goes onto a clear face shield, for example, no, you would not have to do that because they can sterilize that material once it is produced.
Okay, thank you, sir. And Kelly, we'll also, in the follow-up email for everyone, we'll send a link to the information that you talked about at the chamber as well as ours. So you guys will all have lots of resources to call on when you need help.
So one thing I'll add real quick, this is Chris. So under a typical emergency declaration, the act that's in place for reimbursement of PPE requires that you're an approved disaster area, which Tennessee has been through presidential decree, I guess. And then the actual funding for materials or supplies actually has to go through the state agency or local emergency management agency. This event is slightly different from the healthcare side because the CARES Act was passed, which actually allows for medical reimbursement related to COVID responses. So what that has done for us is it opens up this opportunity for PPE that's above and beyond what is typically procured and needed for response to our patients, there's an opportunity for reimbursement for that is included in the CARES Act. So that likely would affect the way in which TEMA or other agencies would respond to this, and potentially what their procurement of the PPE would look like.
Okay. And then we had one other follow-up question with the face shields. Do they need to be sterilized?
No, again, those can be sterilized when they're received at the facility.
Okay.
Fantastic. So if you've just joined the call, or if you've been on the call, what we're trying to do is answer three important questions. This first section, we're completed with it. We're learning about or learning from two leaders, one from the private sector and public sector, who buys the products and how do we get the products to them. And then we're going to move. We're going to do a quick overview of that, and then we're going to move on into answering the questions. Is my own manufacturing operation have the capability to pivot, and then finally we're going to get into a large section just devoted to a lot of the questions that are already coming in around regulations associated with PPE and medical devices. So just to recap this first section of our call, contract opportunities. We've seen private and federal opportunities, and opportunities at the local, state, and national level. And by that, right now, I see it. I mean that we see needs. We're still waiting on contract opportunities on the federal level in a lot of cases. And if you want to learn more, Kelly mentioned one website. We also are encouraging folks to go to this website URL here. So if you do have, you want to help out, you can go to this survey and we can have your information on hand. And we can provide that later in case you don't get it here. So next, we'd like to, again, turn our attention to answering the questions of, is this something that's feasible for my operation? Can we answer all the questions around what could we produce, and how much could we produce, and can we make that sustainable for our business? And we've asked Russell Hubbard, president of Pervivo Laboratories, to share his experience. Russell, we're really proud of the work that he's doing here in the state of Tennessee as a small manufacturer. We've had a great relationship with him for a long time. And Russell has really gone from ground zero, starting point, to producing an innovative surgical mask. I think this mask alternative in a matter of days, and he's really got a lot to share in a short period of time. But Russell, we thank you so much for being on the phone with us and sharing your experience. So if you could just tell us a little bit about yourself and about where you are now.
Can you hear me? Dan, you can hear me?
We can barely hear you, but I can make out what you're saying.
Okay, I'll speak up. I'm using the computer audio. My background's different than most. I came out of the United States Army Special Operations community in 2012, and I started the business that we have today. We simply identified a problem that was occurring in the military, particularly in training environments, where young service members weren't accustomed to high levels of physical activity because they'd spend most of their time on their Xbox or whatever. Suddenly you got to run 5 miles. People were having heat strokes all over the place, and that became problematic. To treat a heat stroke, you have to treat it on the spot at the time that it occurs, or there's going to be catastrophic outcome. I mean, it's that simple. So we figured out a way to develop a textile-based product that can be carried by the cadre or medics, and in the event that that service member or some trainee goes down, they can immediately begin to cool them from that point of injury all the way through the logistical chain or the evacuation to a higher level of care. We just make sheets wet. So, you know, fast forward to 2020, we had some, and I look at this as sort of like a military operation. So a lot of what I say may not make sense, and you'll just have to forgive me. We had some initial intelligence that particularly Cardinal Health had a global recall on their gowns that had occurred. And there was some, I don't know exactly what the problem was, but I believe it was a sterilization issue. So, you know, even before this COVID thing really got going, there was already this problem in the supply chain. So, you know, recognizing that, you know, what could come if we were already having a shortage of one particular item, you know, it's just going to, you know, the snowball's going down the hill, it's just going to get bigger. So we, you know, evaluated what our, you know, our small business capacities were, you know, what strengths we had, what abilities we had, and we realized that we can make a textile-based mask out of the material that we're already using to accommodate for the rules and regulations. We, you know, had inquired and said, you know, if we're going to do this, we're just, it's going to be a sanitary mask. It's not going to be, you know, a level 3, you know, surgical mask or this and that. So what we did was we were able to source filter material that was N100. So we took our textile, we're able to fabricate it using the machinery that we have. We have a cut and sew shop. We send it over and it comes back, and then we insert the filter media into the mask. So, you know, you essentially you have that type mask. When the user's done with it, they discard the filter media that's in there, and they sanitize and wash the carrier. Once it's dry, you can put a new piece in and you're ready to go again. So that's where we are.
Can you share just a little bit about the challenges that you faced in ramping up and getting production going and finding new customers?
Sure. So yeah, so once we had identified it, an engineering firm, Short Fuse Engineering, here in Kingsport, Dr. Justin Stacy, is a friend of mine, and also, you know, a business associate. You know, we said, you know, we're looking at this, so we just created a novel design that we knew we could manufacture. We were doing it on a laser machine, a large format laser cutter that we have. So, you know, we began doing it, and then we began running into issues of repeatability. In fact, that we're using equipment to do something. We're
gonna have to stop, Russell. We're having a difficulty hearing you. So thank you so much for your time, and again, we applaud your efforts. It's amazing what you've been able to accomplish in a matter of just days, really. So again, thank you so much, Russell, and we wish you all the best as you provide these supplies. So I'd just like to move into just a little bit more of, you know, how can we do this? This is a projection of need, but it's also, it's more speaking to the timeline. It's not so much what can we do, but when can we do it? How quickly can we do it? You see here, this is a chart from the IMHE that everyone's kind of relying on as a projection for device needs. And you see here, you know, middle of April, the spike is going to happen. So we're what is it, April the 7th today. we're about to go through it. There will be needs going forward, no doubt. But it just gives you a sense of the urgency that's required. And so if there is something that you want to work out, you just got to be cognizant of that moving forward. Speaking of things that you want to be cognizant of, we want to thank Georgia MEP for kind of breaking this down for us. They did a great job later last week. But as a manufacturer, we've got to decide on 4 key areas to think through the feasibility of producing something like this. And Russell Hubbard makes it sound easy, but so we've got to figure out what do we make. You know, the information, the materials, the machinery, and the people. We've got to make sure all that's lining up in order to produce something. And if there isn't something there, who can we partner with? Is there some license of an existing technology, or can we invent something to kind of fill in the gaps? And so that's, you know, when it comes to filling in the gaps, that's what we're here for. UT-CIS, we want to be a partner. Kelly Boutwell also spoke to this. We want to be a connector for people. And really everybody. Chris Flynn mentioned, you know, there's a lot of the partners that we relied on for material overseas is that they've dried up. So production is coming online, even in the state of Tennessee, for filtration materials, and it's a very fluid process that we want to be a part of with you in trying to get all these questions answered. And I'm not going to speak through all of these, but we have heard, you know, machines going down, machines being procured, new machines need to be broken in, old machines are old. All of they're just, you know, lots of unknowns out there as we move into answering each one of these questions. And we want to be a trusted advisor as we move forward and answer these. So next, so that kind of rounds out our assessment of feasibility section. And now we want to devote the final section to regulations. Again, we're very thankful for all of our partners. It's been an amazing time to be a part of the MEP National Network as we connect Tennessee manufacturers with other manufacturers across the country. And special thanks to Gen Edge, Virginia MEP, for letting us play this. We've got a recording for you. It's been edited. It's really good. Darren Reeves, DP Distribution and Consulting, is, I believe, 30 or 40 years perhaps in FDA certification realm. And so I'll stop my screen here so that you guys can hear from Darren, and Missy's going to bring that up.
So Danny, while we're making that transition, another question on the chat that either Chris or maybe Kelly as well could speak to. The question is, state FEMA agencies not only have lists of suppliers and clients, but they also determine the gap between them. If there's a surplus of supplies, does anyone coordinate to share the surplus with other states? Kelly, did you want to comment on that one maybe?
Hey, this is Kelly again. My comment to that is I think that's being done by your national group, NIST, and by our national group, NAM, in coordination directly with the White House. But I've just read a Wall Street Journal article this morning about all of talking about exactly the gaps and the challenges with FEMA being able to make official purchases with those that are offering. I can share that with y'all as well. So the challenge is real there. Chris may have other info.
No, I believe that some of the states are starting to coordinate amongst themselves as they hear needs in other states and they're voluntarily doing it. Seems to be the way that's occurring based on what the needs are. But I'm sure FEMA is assisting in some manner.
Okay, thank you both. So this next section that we're going to have, it's a pre-recorded video from another webinar we did, but it has a lot of great information about, you know, class 1, class 2, what do I need to be certified to do, and that kind of stuff, that information that companies have been asking for. So we're going to play this, and then we'll wrap up the call with some question and answer time after this part of it. So give me just a second, and I'll get it going.
Devices. There are all kinds of medical devices out there, as you guys know. Specifically, we're going to focus on the PPE, the things that everybody's concerned about, these types of things that we've got listed on here. There's a bunch of different terms out there. I want to make sure everybody's familiar with what those terms really mean and what people are talking about when they're throwing the words out. All right, so the FDA breaks down all medical devices into 3 classes based on risk. And they're real they come up with these real good names, the class 1, class 2s, and class 3. And the class 1 is the lowest risk, class 3 highest risk. And amount of oversight that the FDA has on those devices will tell you it was based on the class. So the next slide I've got here really says, okay, if you've got a class 1 device, which we'll go over what those are in a minute, there's really no FDA oversight on those devices. We can get those into the market, and we can help customers get those into the market almost immediately. We will have some facility concerns, but we can pretty much get those on the market very quickly. Class 3s, on the other hand, those require what we call a pre-market approval, and those cost hundreds of thousands of dollars to get in place. They're life-sustaining devices. You probably will not deal with that. Now you could deal with it in the future after this thing is over with, but just know that they exist. A lot of the problem child that we'll have with this issue will be the class 2 devices. They require something called a 510K approval from the FDA. That is something that we will submit information to the FDA in order to show that our product is as safe and effective as something that's already on the market. So PPE, you hear a lot of that being tossed around. What is the PPE? It stands for personal protective equipment. You'll hear most everybody will say PPE. It's basically the gloves and the gowns and the head covers and the shoe covers and all that sort of thing, and it's to protect people from any kind of hazards. In our industry, specifically biological hazards. So it's a very common term in the industry. With respect to this pandemic, we're really talking about masks, face shields, gowns, gloves, coveralls. All those things are the PPE that we're referring to. Let's talk about some of the differences in what we've got. With masks, there are really 2 different types of masks with respect to the FDA. There are also other protective masks that you find in Lowe's or Home Depot or something like that, but they should not be for medical purposes. They should be marketed specifically for, let's say, dust protection or something like that. The first one, and the one that is actually the most coveted mask, is what we call the N95 respirator mask. That is a class 2 if it was a surgical mask. Now, what the FDA has done, they got together with the CDC, and they put these under what we call an emergency use authorization. So no matter what intended use that mask has right now, you can put them on the market immediately, okay? So these are the coveted N95 respirators. They're also called respirators. Do not get a respirator and a ventilator mixed up. In the olden days, a ventilator was sometimes called a respirator, so people still do use those terms interchangeable. But a ventilator is that big piece of equipment that they're looking for and saying that we're have a shortage of. And the N95/respirator is what's pictured on here. It's got that little filter in the middle of it, okay? So those can be put onto the market almost immediately. The secondary type of mask is what we call, well, let me go back into the N95. The N, basically, it means NIOSH. It's the organization that put out the test methods for those masks. You may also see a KN95, which is a European equivalent. Those can also be put onto the market. Okay, so those are being brought in now. And the 95 means it filters out 95% of the airborne particulates. Those particular masks are designed to protect the user, not the patient. Okay, the second type of mask is really what we call a surgical mask, and some of this stuff is gray. Most masks, if they're for any medical claim, are going to fall into this category. Some have the ear loops like you see at the bottom left, and some have the ties. A lot of people will say that the ties are for surgical use and that the ear loops are for regular patient procedure type of activities, and that's kind of how they use them. But the FDA has tied them all together in some of their guidance documents. Some people today are playing the gray, and they're not even calling it for medical purposes anyway. But if you make a mask and you sell it to a hospital, you pretty much know what they're using it for. So it's a gray animal. We have to go on a case-by-case basis as to whether they're coming from out of the country or whether they're making them in the U.S. Sometimes, right now, pretty much anyone who's making these masks in the U.S. are able to sell them, but we can't get them into the country at this point from other countries. All right, so all of these right now that you've got on the screen here are Class 1 devices and can be sold almost immediately. Head covers, shoe covers, scrub shirts, scrub pants, coveralls, patient gowns. Now, the patient gowns are not surgical gowns. The surgical gowns that you use in these in the OR are a Class 2 device and cannot be sold at this point, but patient gowns can. And also there's a difference between patient exam gloves and surgical gloves. Okay, so make sure that you understand the difference. If you have a customer or client that wants to sell something, whatever it is, today and in the future, what we can do is go into the FDA's database and immediately find out how they classify that device and what kind of regulatory control they have over it. I want to make one other little caveat here. Almost everything I'm telling you has some sort of an exception to it. There are some very small group of Class 1s that do require a 510K FDA approval. There are some Class 2s, actually quite a bit of Class 2s now, that do not have or require a 510K because they've been given what they call, the FDA is not enforcing the requirements for the devices. So we can help you figure out what your client needs with respect to that with a quick phone call or email. Okay. Again, they require 510K. They are regulated by the FDA, and they're usually the sterile products. So some people will sell them non-sterile to kit packers, but if you have those issues, you can contact us so we can help you. Patient exam gloves are usually the ones that you see in the little boxes when you go into your doctor's office and they pull them out and use them during the exam. Again, some of these issues are very gray. That's where expertise comes in to go through and help you learn where the FDA's thought process is. Sometimes they put guidance documents out for different devices. There's a lot of those issues out there that we can help you with if you have specific questions. We can get into all of that during this presentation. There is something called an emergency use authorization, and that is where obviously during this type of event, one organization goes to another and says, can we use these things? From a medical device standpoint, the N95 industrial masks are in fact under the EUA, as well as those test kits that everybody's listening to or hearing about. A lot of those test kits are under EUA in order to get those onto the market very quickly. So those are the types of things that have been going on. We're hoping that some other devices will get onto that list or get into a EUA situation, and I will keep people posted as through the MEPs as those come out. Okay, factory requirements. We know that this is not normal times. Typically and normally, every company that makes a medical product must follow the good manufacturing practices, the GMPs. The GMPs for medical devices are called the Quality System Regulation. It's a QSR. We are not in normal times. So one of the things that we've seen and can help is if is ISO 13485 or ISO 9001 certified. Those are very, very close to the GMPs for medical devices. Matter of fact, they both ISO 9001 was the predecessor to the current GMP for medical devices. So what we need to do and address is find out whether the customer wants to be doing this short term or whether they want to continue doing it after the pandemic is over. If they're doing it short term, what I have seen done in the past was similar, not this type of situation, but similar localized situations, is we can put in a quality plan or some sort of plan saying what we're doing to implementing things and go ahead and make and distribute those products as we're in the process of moving forward. Put in basic controls and we can move from there. It just depends on the organization and what they currently have in place. Okay, so usually putting in, we can also work under template SOPs so that we do have a system in place minimally and move forward to try to help with the pandemic situation. Be very, very careful. The FDA does not approve devices unless it is a class 3 device, and then they will come in and actually approve the device and the facility, and the company cannot change anything after that. So the FDA will not say your device is approved. They will. The 510K is a type of marketing approval, which gives the company the ability to market that device, but it's not an FDA approval of the device itself. And the FDA does not, they do not approve your facility either. So when somebody says, I have an FDA approved facility, most likely it's just that it's registered. Okay, we'll get into that in a minute. So for class 1 devices, you're supposed to have the QSR procedures involved in place, and the company is supposed to register that facility. I'm checking on it now. I'm seeing a lot of companies just go ahead and it depends on whether you're going to go for short-term or long-term manufacturing. The cost to actually register your facility right now is a little over $5,000 for 2020, and it just continually goes up a little each year. So what we would need to do is see, does this company want to actually make the products for the long term, or they're just doing it to help out the organization? I do have a question, that exact question into the FDA now, trying to figure out, okay, if we're just going to do this for the next 3 months, do we need to register the facility? I'm seeing it not being done, and I'm seeing them not enforce it at this point. I can't definitively say that on behalf of the FDA, but that's what I'm saying. Okay. And we can help register any organization out there that they want to start doing it long term. So that's for class 1s. Class 2s, basically the same as class 1, but we need to get a 510K normally, which means we find something that's already on the market, and we do the testing that's required to demonstrate that our product is on the market. I mean, is as safe and effective as that, what we call predicate. And what we're doing now is we're doing it simultaneously, and we're seeing that it's being accepted by the FDA. We're actually submitting that paperwork and the testing. Once we've got the testing, I've got several clients now that are marketing those products in order to help the pandemic, and I'm not seeing any pushback from the FDA yet. And for example, want to also make you guys clear, the ventilators that they're talking about, the equipment that GE is making now, they are a class 2. They are not a class 3. Okay, so the class 3s are more along the lines of an artificial heart valve or something that's going to keep the patient alive. If it were to fail, it's definitely going to harm the patient adversely, in other words, kill them. Okay, so those ventilators are class 2. Class 3s, again, life-sustaining, probably won't deal with these. You will need a PMA, which is the only approval the FDA has. If you ever get into that, then you're going to need additional support. One unique item is that hand sanitizer and the alcohol that goes into the hand sanitizer. The FDA has written guidance documents for both of those, allowing for enforcement discretion under very strict guidance. Okay, so we're seeing now that a lot of the breweries, distilleries, and those types of things are trying to jump in to help offset their businesses and also help the pandemic issue, and starting to try to make the hand sanitizer in their equipment because they're very well capable of doing it. Here's the 2 documents that are written for those on the very guidelines on the hand sanitizer, and they have very specific guidelines on how to allow the manufacturing of the alcohol, but they are using enforcement discretion, which means they will not go in and adversely affect any business that's following these guidelines. If you do make the alcohol, they are asking that you register with the FDA just so that they know that you're doing it, but they have no intent of going into and auditing your facilities. Okay, as we said, things are changing daily. There may even be something in this new bill that just passed on the ability to manufacture face masks. As we get additional information, we will pass this out to the MEP and get that information out to you guys. I know.
All right. All right, Danny, I'm going to turn it back over to you. I do have a really good Q&A that goes along with that video that we'll send out to everybody in a follow-up email. And it also show you, we had a couple of questions, you know, is our N95s class 1 or class 2, face shields class 1, class 2, that kind of stuff. It'll show you how to look up that information and some of the questions that go with that type of stuff. So I'll send that out in the follow-up email. Danny, you're muted. There you go.
Thanks so much, Misty. Can you hear me now?
Yes.
All right, great. And again, thanks again to Darren Reeves and Gen Edge, Virginia MEP. He would have been on the call live. He just said he couldn't do it any better than the recording. So he is available to Tennessee manufacturers for questions. And there was a lot of gray area, obviously, as you heard. So we can connect you with him if the recording didn't answer your question. So thanks again to everyone for being on the call. That concludes our call today. We had 3 sections, a section on what are the needs out there, who's buying these products, what's the timeline. We had a brief section on trying to figure out, you know, what is this feasible for your operation, and then we dove into and heard from a regulation specialist to try to figure out that type of thing, because we see so much that to be a common theme as far as questions that are concerned. And we'd also like to just let you know that we're here to help as you move forward, and please contact us if you have any questions. We also want to make sure that you fill out this survey, surveymonkey.com /R/CV19 critical supply. That is the survey that is a part of our nationwide effort with the MEP National Network to combine forces and get supplies to the areas that need them most. So again, thank you so much for being on the call, and we appreciate you.